Silent heart attacks in women, unveiling the overlooked warning signs. Heart attacks are a leading cause of death globally, and recognizing the signs, especially in women, is crucial for timely intervention and survival. Renowned cardiologist Dr. Jeremy London sheds light on the unique ways heart attacks manifest in women, emphasizing the need to recognize subtle symptoms that often go unnoticed or misattributed. Dr. London's insights, shared on social media, particularly Instagram, highlight the importance of vigilance and preventive measures for women's heart health. Unique heart attack warning symptoms in women. Heart attacks in women often present differently from those in men. While the classic stereotype of sudden, severe chest pain is true for some, Dr. London reveals that many women experience more silent or subtle symptoms that can be easily overlooked or misinterpreted. These atypical presentations contribute to delayed medical care, which can be life-threatening. Dr. London explains that women may experience chest pain, but it is more likely to be pressure, tightness, or discomfort rather than the intense crushing sensation men typically describe. Moreover, women often report pain or discomfort outside the chest, such as in the jaw, neck, shoulders, upper back, or abdomen, which can lead to misdiagnosis as dental issues, muscle pain, acid reflux, or stress. Crucially, Dr. London emphasizes that women's heart attacks may also involve other non-pain symptoms, which are critical yet frequently underestimated, including shortness of breath. One of the earliest warning signs may be difficulty breathing, without the presence of chest pain. Unusual fatigue. The attack may be preceded by days or weeks of unexplained fatigue. Gastrointestinal symptoms. Nausea or vomiting can sometimes mimic gastrointestinal illness. Dizziness. Women may experience dizziness or lightheadedness. Cold sweating. Cold and clammy sweating, different from normal perspiration. Anxiety. Anxiety or a feeling of impending doom may be similar to panic attacks. These softer symptoms demand increased awareness from both women and healthcare providers to facilitate quicker diagnosis and intervention. Risk factors for women's heart issues. Research underscores that risk factors for heart disease in women must be considered within a broader context. Postmenopausal women are at higher risk due to declining estrogen levels, but other factors significantly increase the odds across all age groups. Diabetes mellitus. Women are more susceptible to heart attacks than men with diabetes. Hypertension. High blood pressure is a significant risk factor. High cholesterol, dyslipidemia increases the risk. Smoking. Smoking is a major risk factor, especially for women. Sedentary lifestyle and obesity. Lack of physical activity and obesity contribute to heart health issues. Family history. A family history of heart diseases increases the risk. Stress and depression. Mental health factors can significantly impact heart health. Dr. London combines medical expertise with practical lifestyle advice to break down complex medical jargon, empowering women to take proactive steps towards prevention. Awareness is key. Heart disease has long been mistakenly perceived as primarily a male disease, leading to less awareness of its unique impacts on women. Dr. London highlights the real-world consequences of this misconception: delayed diagnosis and treatment, increased mortality and morbidity. Comprehensive education that covers the full spectrum of symptoms, especially those without chest pain, could significantly reduce these disparities. Moreover, healthcare providers need specialized training in identifying and diagnosing heart attacks in women. Women themselves must become advocates for their health by understanding their unique risk factors and how heart attacks may present differently from the classic symptoms. Practical advice for women. Based on Dr. London's clinical experience and social media insights, women can take the following practical steps to reduce their risk of heart attack and respond promptly to warning signs. Know your risk factors. Regularly discuss personal risk factors with healthcare providers. Exercise regularly. Engage in cardio exercises like walking, swimming, or Tai Chi. Adopt a heart-healthy diet. Focus on fruits, vegetables, lean proteins, and whole grains, while reducing processed foods and sugars. Avoid smoking, don't smoke, and avoid secondhand smoke. Manage stress. Practice mindfulness, meditation, or other stress-reducing techniques. Act quickly, don't trivialize symptoms like nausea, fatigue, and breathlessness. Seek immediate medical help if experiencing any combination of these symptoms. Chew aspirin. If not contraindicated, chew an aspirin while waiting for emergency responders. Dr. Jeremy London's insights emphasize the importance of special attention to heart attack warning signs in women, as they often differ from those in men, are less dramatic, and are no less dangerous. His social media outreach and public speaking initiatives promote early recognition of these subtle signs and lifestyle choices that support cardiovascular health. For women, understanding these differences and acting promptly can be life-saving.